I want to turn it to Senator Carper, who is visiting our committee today, but he is welcome because this audit, he was one of the primary requesters of this audit. He is a one-man vigilante when it comes to improper payments. This is somebody who has been on this for as long as I have been in the Senate. He's been working on improper payments. We're happy to have you today and welcome your questions.
Thank
Senator
you.
Carper.
Thank you so much. And my thanks to you, to our chair, for giving me the opportunity to come by. I used to serve on this committee, and I said to Senator Casey one day, Senator Reid said to me, "Would you like to be on the Finance Committee?" I said yes. And he said, "Would you be willing to give up the Banking Committee?" I said yes. "Would you be willing to give up the Commerce Committee?" I said yes. He said, "Would you be willing to give up Aging?" And I said no, but I ultimately gave it up. And now I no longer serve on any of those committees, but I'm glad to be where I am on the others. So thanks for giving me a chance so you can come home again. And so I thank you for the opportunity to come back. So I may have been a vigilante, but I'm not a one-man. And you've been part of the Postal, and God knows Senator Collins has been, along with Tom Coburn, all of us who have served at one time or another on Homeland Security and Governmental Affairs. And you just ask Willie Sutton, "Why do you rob banks?" He says, "That's where the money is." There's a lot of money at stake in Medicare, Medicaid, and it's a lot to say grace over, and we acknowledge that. And applaud CMS and those who are trying to be vigilant and making sure they're good stewards of all of those dollars. Having said that, I watched with dismay as we learned at the beginning of this year that the improper payments for last year, 2014, did not go down, despite all of our collective efforts, including all of what we put in the Affordable Care Act to kind of strengthen the hand of CMS to go after improper payments, to actually see them go up, and not by a little bit, but by 20%, by $10 billion, from roughly $50 billion the year before to last year, $60 billion. Let me just start off by saying to a representative from GAO, Mr. Bagdoyan, why did it go up? Why so much? I was astounded.
Well, thank you for your question, Senator Carper. That bit of insight was beyond the scope of our work. There may be a range of reasons for that, but I can't really comment on specifics.
Okay. Same question, if I could, Dr. Agarwal. Why did it go up? Just very briefly.
Sure, thank you.
$10 billion, 20%. After all this effort that we put into it. We have, you have.
Yeah, the improper payment rate is definitely an area that we are continuing to focus on and appreciate your leadership on. We've seen a few major drivers of the improper payment rate. One thing that we've seen is as our program integrity efforts increase, as we get more vigilant, providers can sometimes have a hard time keeping up, which can drive up the improper payment rate for a while until they learn our new rules. One example of that is the home health face-to-face requirement, which I think is obviously very sensible policy. It makes a lot of common sense, but it has led to now over 50% of home health claims being improperly paid. In other words, where the medical record documentation of the face-to-face requirement isn't sufficient to meet the standards of the requirement. Not, as you know, certainly, Senator, the improper payment rate is not a fraud rate. It is not overlapping with fraud. I think these are usually vigilant providers that are trying to keep up with rules that we can do a better job to educate. We can also do a better job to move our reviews to a prepayment world through efforts like prior authorization, as we're doing, to help drive down the improper payment rate.
All right, thank you. Mr. Bagdoyan. Mr. Bagdoyan, has anyone ever mispronounced your name? Okay. Well, good. I'll try not to do that as well. In his testimony, Dr. Agarwal said that he recognizes the importance of the problem that we're talking about here today, and he's trying to take steps to address those problems. Could you just comment on CMS's plan for addressing the vulnerabilities that GAO has identified? Do you think this plan is adequate?
Sure. Thank you for your question, and I appreciate Dr. Agarwal stating that CMS has agreed with the recommendations. They've already initiated some steps to respond to them, including providing us with responses to the referrals we've made. I think the absolute key here is sustained execution and attentiveness to a strong internal control regime, front, middle, and end, to help address some of the issues that we identified.
All right. Dr. Agarwal, your testimony demonstrates, I think, fairly clearly that You and your colleagues take seriously what the findings of GAO, and you stated your commitment to addressing the identified vulnerabilities. Could you just give us a little more detail as to when you will have implemented these steps, and what is your timeline for closing the vulnerabilities described by GAO? I'll just say, for me, one of my frustrations here is there's, we all heard the term low-hanging fruit. This is not low-hanging fruit we're talking about. This is a fruit that's laying on the ground. And I just want to hear a sense of urgency that, that we're going to seize this day. We're going to seize this day, but go ahead.
Absolutely, Senator. And we do have a sense of urgency. We have staff that are focused on provider enrollment every day as their main job, and they want to get all of these bad actors out of the program as well. So, for example, when it comes to ineligible addresses, the GAO has recommended onboarding a new database through the USPS to essentially replicate the work that they did. We agreed with that recommendation. The time for we need a certain amount of time to get access to the database, verify it, get it incorporated into our systems, and so we're targeting doing that by early next year. However, in the intervening time frame, we are also going to do other work as we onboard the final fix. One is we are going to be doing more ad hoc site visits of these limited risk providers, since again, those were the ones that kind of fell through the cracks in our screening process. We are going to do several thousand site visits right away and then work to ramp that up in the coming months. When it comes to mailboxes, we are also going to immediately start comparing lists of these CMRAs, these commercial mailbox agencies, bump that list up against PACOS. We're going to do that on a routine monthly basis, and then visit, investigate whatever comes out of that in this intervening phase until we get until we get this database incorporated.
All right. If I could, Madam Chair, you and I worked for a lot of years on postal reform. And one of the things we've tried to do is to help the Postal Service figure out how to take a 200-plus-year-old legacy distribution network and find new ways to make money out of it, to monetize it in a digital age. It occurs to me that at a time when we have thousands of so-called Medicare providers that are operating out of a mailbox, or that may be operating, if you will, out of a empty building or a vacant building, a vacant lot, that you got the Postal Service over here that literally knows what is there in each of these delivery sites. There's got to be some way. The Postal Service is looking for a way to make money. They have this information. There ought to be a way to provide a great partnership which enables the folks at CMS to save a ton of money in Medicare and provide, frankly, a revenue stream that the Postal Service could use. And I'm going to pursue that. And maybe my hope would be that the two of you would join me in that pursuit. Thank you so much for letting me come by. Thank you.